Hello students, welcome back in another video. Hope you all are fine and having good time with your family. So in today's session, we are going to discuss class 7 civics chapter role of the government in health. What we are going to study? In this chapter, we are going to study about health. Healthcare in India, public and private health services, healthcare and equality, what can be done, the Kerala experience, the Costa Rican approach. What is health? Health means our ability to remain free from illness and injuries. So it is to be free from illness and injuries. There are many kinds of illness like fever, malaria, stomachache. Like that, there are various diseases through we get affected because of these result illness. Sometimes people get injuries also, so being free from it is called health. As well as there are some other factors which government has to notice for making public health. These are clean drinking water, pollution free environment, adequate food to eat. So, need of clean drinking water is so much important. See, it is very difficult for the people living in slums to get clean drinking water. If they don't get clean water, it results illness and spread of many diseases. Next, pollution free environment. If we are staying in a polluted environment, it results many diseases and illness. Next, adequate food to eat. It means sufficient amount of food that your body requires to maintain day-to-day activity. In case if a people don't get sufficient amount of food, it results in illness. Healthcare in India. So let's discuss healthcare in India. Let's discuss with some points and comparison of these points. So first point, India has the largest number of medical colleges in the world and is among the largest producers of doctors. But most doctors settled in urban areas. People in rural areas have to travel long distance to reach a doctor. The number of doctors with respect of the population is much less in rural areas. Next, healthcare facilities have grown substantially over the year. In 1950, there were only 2,717 hospitals in India. In 1991, there were 11,174 hospitals, and in 2000, number grew to 18,218. But despite of this, about 5 lakh people die from tuberculosis every year. This number is almost unchanged since independence. Almost 2 million cases of malaria are reported every year, and this number isn't decreasing. Next, India gets a large number of medical tourists from many countries. They come for treatment in some of the hospitals in India that compare with the best in the world, but still we are not able to supply clean drinking water to all. 21% of all communicable diseases are waterborne, for example diarrhea, etc. Next, India is the 4th largest producer of medicines in the world and is also a large exporter of medicine, but half of all children in India do not get adequate food to eat and are undernourished. So, India has a large number of doctors and health centers. Some of our hospitals have facilities that are among the best in the world. Many people visit India as medical tourists to get treatment. India is also a leading producer of medicine. In spite of all these, a large number of people die here from preventable causes. Often people cannot get timely medical help as they have to travel long distances to reach a health centers. Many cannot bear the cost of treatment. The steps taken to stop the spread of infectious diseases are not enough. Many Indians still do not get clean water to drink and enough food to eat. So there is still a lot that the government can do in the field of public health. Public and private healthcare services. In India, there are two types of healthcare services: public healthcare services and private healthcare services. The public healthcare services is a chain of health centers and hospitals run by the government. These run at village level, at district level, and in big cities. Main feature is to be provide quality healthcare services, either free or at a low cost. Another important function of public health is to take action to prevent the spread of diseases. Private health facilities or private healthcare services. These facilities provided by private doctors and hospitals. They are run to earn profit and are therefore very costly. Healthcare and equality. In India, we face the situation where private services are increasing but public services are not. In fact, only 20% of the population can afford all the medicines that they require during an illness. For poor, every illness in the family is a cause of anxiety and distress. What can be done? It is important to work on healthcare and basic amenities in order to improve the health situation to our people. So, here are two examples how the government improved these conditions. First example, the Kerala experience. The government of Kerala has succeeded in providing public health remarkably by providing health services through panchayats. The panchayats, being more aware of the specific needs of the villages, have been able to plan and carry out schemes for providing water, sanitation, medicines, health information, etc. as required. Second, the Costa Rica approach. The government could also try to spend more of its funds on public health. An example of this was set by the Central American country Costa Rica. This country's government abolished the army in 1948. It means they decided not to have an army. Thereafter, the money that would have been spent on the army was spent on health, education, etc. This significant improved the Costa Rican people's welfare. Hope you understood the topic. Stay home, stay safe, safe life.